Good morning. Today's topic is Surgically Assisted Rapid Palatal Expansion or SARPE. Surgically Assisted Rapid Palatal Expansion or SARPE is a technique used to correct transverse maxillary deficiency. That is, when the upper jaw is too narrow compared to the lower jaw. It is mainly carried out in adult patients where the ossification of palatal suture is completed. Coming to the indications. SARPE is mainly indicated when the maxillary deficiency is greater than 5 mm in skeletally mature patients. It is also indicated in cases of posterior crossbite or arch constriction. Next, in cases where the orthodontic expansion has failed or is not feasible due to skeletal resistance. Now, coming to the procedure of surgically assisted rapid palatal expansion. So the first step that is carried out is there is an orthodontic expansion appliance such as HAS or Hi-RAS expander, which is actually similar to the maxillary tape. The second step is under general anesthesia, surgeon performs certain osteotomic procedures to release the areas of resistance. And these osteotomic procedures include leaf-out osteotomy, mid-palatal osteotomy, and pterygomaxillary distension. The third step is, after a latency period of about 5 to 7 days, the expander that is fixed in the maxillary teeth is activated to about 0.5 mm per day for 2 weeks. The fourth step is, the device is left in situ for about 3 to 6 months. Now let us discuss about the advantages of SARPE. First one, it achieves true skeletal expansion in mature adults. The second is, it improves the nasal airflow and it also helps in attaining a good dental arch form. Now, limitations of surgically assisted rapid palatal expansion. It requires general anesthesia and surgical osteotomies. Then, the potential risks include infection, relapse, and asymmetric expansion. Now, coming to the postoperative and orthodontic considerations. During the procedure, a midline erythema appears, which actually confirms the successful suture separation. After that, the orthodontic treatment is carried out to align the teeth to the newly widened arch. During this procedure, patient may experience nasal stuffiness, discomfort, or mild bleeding. To conclude, surgically assisted rapid palatal expansion bridges the gap between orthodontics and orthodontic surgeries, allowing the correction of transverse maxillary deficiency correction in adults, which was one thought only possible in growing patients.